Hello, I'm Carol KURLAND, Chairman of the Board of the Cancer Support Community, Los Angeles. On behalf of our board and our staff, thank you for joining us and being part of the Spirit of Community annual event, honoring an awesome group of healthcare partners.
Hello, my name is Julia Forth, and I'm the CEO at Cancer Support Community Los Angeles, and it is my pleasure to welcome you here today to our Spirit of Community celebration. I'd like to thank our sponsors for their generous support of this event. Our premier sponsor, Walgreens, our benefactor, Annie Benjamin, our gold supporter, Providence St. John's, our silver supporters, Carol KURLAND, Elizabeth Lesser, and Len Wexler, our honoree champions, Adventist Health White Memorial, Linda Kaplan, CSCLA, Marion Levy, and Dr. Melanie Goldfarb and Amir Kovacs. I'd also like to thank our hardworking board of directors, led by board chair Carol KURLAND, our professional advisory board, and our hardworking staff. Today, you will be meeting health provider teams from UCLA, Cedars-Sinai, Providence St. John's, the Cancer and Blood Disease Institute Children's Hospital Los Angeles, and Adventist Health White Memorial, all of whom have worked in partnership with Cancer Support Community Los Angeles for many, many years. In fact, this year is our 40th anniversary. For 40 years, the Cancer Support Community Los Angeles has been providing free of charge services to anyone impacted by cancer. So let's take a look at this short video about our long history of service.
Our immense thanks to Cancer Support Community. We know that your motto is, so no one faces cancer alone. Boy, do I know what you mean by that.
My father's name was Harold Benjamin, and he was the founder, along with my mother, Harriet Benjamin, of the Cancer Support Community, previously called the Wellness Community. Mom got cancer, and they realized that actually going to support groups made such a difference in her recovery. So my father decided that he would create this organization that would really make a difference in the lives of people with cancer and their loved ones. Gilda Radner came to the organization. She was so excited about how this changed her life. When Gilda passed, Gene Wilder and a woman by the name of Joanna Bull decided to start Gilda's Club in New York City. Several years ago, the Wellness Community and Gilda's Club joined forces.
We are a community, and we sustain each other through community. Aside from the services that we give, this is a very important gathering place of hope and support for people.
We laugh a lot in the groups, we cry a lot in the groups. I've made incredible lifelong friends.
I did not know that I was going to live, and I met someone in the group who had been alive for 7 years, same tumor grade, same location, and had been alive for 7 years and had two little kids. And I needed the imagination to know that I could survive, because I was so certain I wasn't going to.
When I got the news, I think I was numb, and it got really challenging having to break the news to my family because I didn't know how they would take it.
Until we are able to get rid of this disease once and for all, it's nice to know there's a lot of support to help you get through it.
The people that I've met here, I will be friends with for the rest of my life. The things that you can talk about are very personal. It's a safe place. When you get in a group, you realize that your problems really aren't that bad.
I passionately believe that the cure to cancer is not just the medications and the treatment that they give you. And what we found in the support center here is this amazing experience of being able to come here, find all those other things that make it a holistic treatment.
We have 5 pillars of support: groups and counseling, healthy lifestyle classes, educational workshops, social activities, and child, teen, and family programs. All of those pillars work together to create a holistic way of supporting not just the patient, but the family members.
I have discovered the Celebration Circle. That's a wonderful time just to get together and think about the good things that are going on in your life, and to express gratitude, and not so much dealing with the cancer all the time. And it's a time to sort of fellowship over good food and good conversation, and really having a time of just celebrating the life that we have.
I think that once people find out about this community, I'm hoping that they will be generous with their donation, because everything for the patients here and for the families is free. And we depend on the generosity of people who have the means to give back.
And what you do more than any organization in the world is you give a sense of hope. Even if it's just one more day, one more week, one more month.
We really appreciate your donations. We appreciate your concern and commitment to this organization.
I think that's the true definition of love, when you can love someone or do something for someone that you don't know. Thank you.
I just want to say thank you, because it has given me like a family, and being able to connect and meet such amazing people like that in this space is just such a gift. Like, you're really giving people a gift by your donations.
Now that I've gotten through what I hope is the worst of it, I can look back and say that the cancer support community was one of the joys that this experience has brought to my life. So thank you for allowing me to have that experience, for giving me another place I can call home.
Welcome back. I'd like to thank all of you who have donated thus far and who have participated in our tribute journal in support of Cancer Support Community Los Angeles and our honorees. This journal will be open for contributions and messages of congratulations throughout the month of March, and will be on our website all year. If you have not already participated, please consider doing so. Any size contribution is welcome and appreciated, and we thank you. Please go to www.cancersupportla.org or call 310-314-2514 to leave a message, and we'll get right back to you. And now, a word from Cancer Support Community Los Angeles longtime supporter and Emmy Award-winning actress Sharon Lawrence.
I'm Sharon Lawrence. You might know me from television shows such as NYPD Blue or Grey's Anatomy or Joe Pickett. And I feel very privileged to be with you here today and to honor the difference that you make in the lives every day of those of us in Greater Los Angeles. I can only imagine how difficult it must have been to deal with the pressure and the strife that all of you faced and had to overcome during these unprecedented times. So on behalf of CSCLA, I want to thank you for your work, for your compassion, for your commitment to any and all of those facing a cancer diagnosis.
When Harriet Benjamin was diagnosed with breast cancer, she and her husband, Dr. Harold Benjamin, made it their mission to ensure that no one faces cancer alone. Harriet was our inspiration and champion, and we are so pleased today to be honoring Dr. Eva Myers with the Harriet Benjamin Champion Award. For over 10 years, Dr. Myers has been the Cancer Support Community Los Angeles champion at Adventist Health White Memorial, Cecilia Gonzalez de la Hoya Cancer Center in East Los Angeles. Dr. Myers has always recognized the importance of psychosocial support within this caring safety net hospital. Dr. Myers is a professional oncology nurse practitioner, and her specialty is breast cancer outreach, diagnosis, treatment, and survivorship care. Her academic preparation has included every level of nursing education, including staff and leadership roles, and with diverse ethnic and low-income populations. Dr. Myers states, "Life is all about collaboration," and we couldn't agree more. Take a look at this short video and my interview with Dr. Eva Myers.
My name is Eva Myers, nurse practitioner, and I'm here on the beautiful campus of Adventist Health, White Memorial Medical Center in East Los Angeles. Behind us is the Cecilia Gonzalez de la Hoya Cancer Center, and we're inspired every single day to find the best treatments and solutions to treat breast cancer. Please know we have very good treatments for breast cancer these days. Most breast cancers are treatable and have very good outcomes. So please work with your doctors and your treatment team so that you can have the best outcomes possible.
Welcome, Eva Myers. We're so thrilled to be honoring you with the Harriet Benjamin Champion Award at our Spirit of Community event.
Oh, thank you.
And I just wanted to start off by talking a little bit about your background so that people can get to know you a little bit. I see that you're not only an RN, but a PhD and an FNP. Can you talk a little bit about what an FNP is and also anything you want to say about your PhD?
Certainly. Thank you so much for the opportunity. I'm totally honored to be receiving this award. FNP stands for Family Nurse Practitioner. That means it's a registered nurse with a master's degree. As a family nurse practitioner, we work in collaboration with the rest of the healthcare team. Once anything is beyond our scope of practice, it's usually no problem for us to refer to the physicians and to the other specialty parts of the team. My PhD is also in nursing, and that just allows me the opportunity to also explore areas like clinical research. So I work here in the beautiful Cecilia Gonzalez de la Hoya Cancer Center. Our goal is to provide high quality care, excellent cancer care right here in the East Los Angeles community. We are a safety net hospital, and 92% of our clients speak Spanish.
What would you say a typical day for you is like? Is there a typical day?
We stay very busy. I'm actually coordinator of the cancer detection program. And largely my role is to work with the state of California public health programs called Every Woman Counts. And that's been available for almost 20 years now here in the state of California, where we are able to locate eligible women, many times first generation people to the county, to Los Angeles County, many times uninsured or underinsured, and they have little access to care. So at least with Every Woman Counts, we're able to provide free breast and cervical cancer screenings to this population of women. Once they are diagnosed with cancer, now we're able to enroll them in what we call breast and cervical cancer Medi-Cal, and they have a full scope of treatment. They can actually treat their cancer here in the community hospital setting. Many times women will walk in saying, look, I've just been diagnosed with breast cancer, and they've, because of my immigration status, they've said that I will be treating at Harbor UCLA, but I can't even get in to see my first doctor in 4 months, for instance. And it's just such a blessing to be able to say, we can help you here at the community hospital setting. Sometimes they're halfway through treatment 4 months later, and just being able to pull together quality resources and serve the women makes such a big difference. I love saying, I can help you. Let's get this started right away.
How has the pandemic been affecting you and your team there? What would you say has been the most challenging part of things for you and your colleagues?
Yes, it's certainly been challenging times for all of us. It's well documented how women sometimes are delaying cancer screening services because of the pandemic. There at the beginning of the pandemic, they were even considering routine mammograms as like non-essential services. Some of our elective surgeries or breast surgeries were even delayed because of staffing or COVID issues. It took a while for all of us in the healthcare world to figure out, how can we move forward and still protect people and keep everyone safe. And early detection is the key when it comes to cancer. We're all at risk just because we have breast tissue as women. At least let's find it early when it's really easy to treat and cost effective, and the outcomes are so much better. So it all begins with the screening.
Yes, and so speaking of that, I want to make it clear that we've been able to offer these Spanish speaking programs online during the pandemic. We haven't had to stop them, so that's been great. Why have you been such a champion for psychosocial support?
Yes, the medical team can provide the best that science has to offer, but with something as complex as cancer and with the chronic disease nature of cancer, we just can't go this alone. It's impossible to travel this world alone. Life becomes too hard.
Yes.
So the value of psychosocial support is for the patients to understand that they're not alone, that there are lots of people have to go through this cancer journey, that many times the treatments, that the cancer is treatable. There's no reason to give up hope. We just have to pull together our resources and resilience and get through this next 6 to 10 months. And then we have full expectation that in most cases that life will continue forward again.
Would you say that there's been any specific challenges and opportunities in serving the Spanish-speaking population with psychosocial support?
I think, again, it's coming together as a team and being able to provide quality care and good, strong information in their own language, in their own culture, in a way that they can receive it and build a sense of trust when treatment is available. So getting people the information in a way that they can make the best decisions for their life is sometimes a priority of mine.
Yes, thank you. And Cancer Support Community Los Angeles is perfectly aligned with that sentiment in terms of educating, giving people the information that they need. You are our champion, Eva. You've been a champion of ours for so many years, and we're absolutely honored to honor you with the Harriet Benjamin Champion Award.
Thank you, Julie. Thank you to all of you. Let's keep moving forward.
Our next group of honorees are Spirit of Community awardees. This award, and indeed this event, was established by Harriet Benjamin as a way to honor those in our cancer care community. The resilience and strength of these awardees during this pandemic has mirrored the strength and resilience of our own clinicians here at CSCLA. It takes all of us together to serve this huge, diverse city and county, and we are so grateful to have the caring, compassionate partnership of these unsung heroes at our LA hospital systems. Congratulations, awardees.
Hello. In March of 2020, CSCLA responded quickly to seamlessly transition our full menu of supportive services to an online platform. We are happy to share that our services have continued digitally, uninterrupted, during this great time of isolation and increased need. While we are not yet in person, we are providing the same comfort and connection in our virtual support groups. We cannot wait to invite our members back to our in-person services while continuing to offer virtual support, so all patients and families may find hope, strength, and a sense of community. We cannot do it alone, which brings me to our next honoree. For years, CSCLA has partnered with Cedars-Sinai to deliver healthy lifestyle classes, and we are grateful to their caring medical and mental health providers for their participation in our educational programming. Our incredible relationship with the support care team at the Cedars-Sinai Patient and Family Support Program and the Angeles Clinic has been a lifeline for our mutual patients and families, and for all the members utilizing CSCLA services. This group of dedicated social workers, led by J.K. Vandergaag, provide critical supportive care at Cedars, and they have been integral in collaborating with our team of almost 20 clinicians to give our patients and families at CSCLA the quality care they deserve. I would like to name the members of the Cedars-Sinai supportive care team to express our deep gratitude for their referral and partnership. Thank you to J.K. Vandergaag, Nicole Cagey, Jessica Ernest, Rachel Price, Jenny Christensen, Melinda Sobel, Elaine Wittert, Jennifer Drew, Bonnie Yu, and Andrea Danner. It is my pleasure to present the Cedars-Sinai Cancer Patient and Family Support Program team with the Spirit of Community Award. Congratulations.
You never know what's coming your way, but I just know that this team is always ready to step in whatever comes our way, and we try to figure it out, right? We try to problem solve, we try to network with other organizations like yours, because we really are based on leveraging the community, because that's really what we find most helpful, and that's our value system as social workers. No, but the average, right? We hope to interact with patients. We hope to talk with patients, check in with patients, see how they're doing, see what's helpful to help them get through whatever stage they're at. It's a whole range of services that we offer.
I think one of the biggest challenges that we faced during the pandemic is that caregivers haven't been allowed to join our patients in their appointments. And a lot of times when, you're a patient receiving a diagnosis or information about progression of disease, it's very, very difficult to stay present in that moment. Patients go into fight or flight, for example, so there's not a historian or caregiver an extra set of ears to actually hear what the doctor said.
As social workers, one of the things that we always get to be is creative in our problem solving with patients. And I feel like that has been the challenge of trying to find new resources or to problem solve when with transportation or housing, there are a lot of resources that are not available that were available before the pandemic. And so just trying to help patients still access care while they're going through additional turmoil has been challenging. And so I think as a team, we've really had to work together to be extra creative and really lean on each other and work together that way.
We definitely have had to shift to telehealth, and I think that we've been able to reach a lot more people in that way, and not just with individual sessions, but even our group offerings have been virtual. And so historically, people that may not have been able to attend a group because of work or not being able to get to a facility to have that in-person group, they may be able to actually connect with the group at this point if it's being held virtually, because it gives them a little bit more flexibility. So that has been something, a positive, like Melinda said, that has come out of the pandemic.
I also think it's interesting that this is the first time, at least in all of our careers, that we're going through a similar parallel process that our patients are going through with COVID. So it's interesting to see how they're responding to it. Well, we're also responding to it and how to navigate that. So I thought that was really interesting. Having this group, we meet twice a week, which has been really helpful just to talk about that in particular, how everybody's doing, checking in. So I thought that was really challenging during this time.
Yeah, I would say in addition to that is also, our patients can't rely on their usual coping skills during COVID that they used to fall back on. And same with us as clinicians. So that's been the parallel process as well, is really exploring new coping skills to kind of navigate COVID and being in a pandemic together.
I also wanted to actually add a positive that has come out of COVID. We have so many patients, as you can imagine, who are very fatigued, very weak, having side effects, and they need the mental health support and emotional support so badly, but don't really feel up to coming to the office. And so because of that, we all have had to learn how to navigate this virtual world. And while it has its complications and glitches, it has allowed us to provide support to people who otherwise wouldn't have gotten support because they didn't have the energy to come into the office. One of the kind of beautiful things that's come out of this is a sense of unity. I feel that all of us, CEDARS and cancer support community and all of the other wonderful resources out there, we're working together to provide effective and helpful patient care. And so it's nice to see that unity in us coming together.
Really enjoyed being able to provide telehealth and just getting a glimpse into our patients' lives in a way that we haven't had the ability to do before. So either if they're feeling nervous, it feels like we're right there with them.
I think COVID has also opened a lot of conversations surrounding mental health. And so it's also opened a lot of doors in terms of people who would previously have been really resistant to engaging with a social worker or a marriage and family therapist. It's really allowed us to have more rich conversations and engage with individuals who previously we probably never would have been able to connect with.
I'm probably speaking for all of us, but I just want to express appreciation to everybody over there at CSCLA. I referred so many of my patients, and it just makes me so happy when they come back to me and they say, oh, I joined the young adult support group and I've met so many friends and I'm so glad you told me about it. And it just, the feedback that I get from my patients is excellent. And I just wanted to thank you so much. We're very fortunate to have you as partners.
Hi everyone, I'm sitting in the CSCLA Child, Teen, and Family Room. CSCLA's Child, Teen, and Family program provides support for the whole family, including children living with cancer and children that have a parent, sibling, or other family member with cancer. We offer a safe and welcoming space for children and teens to connect, learn coping skills, and have fun, but we can't do it alone. The social work team at the Cancer and Blood Disease Institute at CHLA is a team that we greatly depend upon, and we're thrilled to honor them today. Liesl Schweers is a licensed and board-certified oncology social worker and has worked at Children's Hospital Los Angeles since 1999. Liesl serves as the primary psychosocial clinician for the Life Cancer Survivorship and Transition Service. Carla Garcia is a clinical social worker for the neuro-oncology program at Children's Hospital Los Angeles. Carla has been a member of CHLA's neuro-oncology program since 1992. And now it's my pleasure to present Liesl and Carla at the Cancer and Blood Disease Institute, CHLA, with this Spirit of Community Award. Congratulations.
At Children's Hospital Los Angeles, every team member comes to work with a single goal: to build healthier futures for children. Here, the finest minds in medicine come together to advance care and discover cures to benefit children. Our caring, committed team members work tirelessly to turn healthcare into health transformation for every child. Children's Hospital Los Angeles, the place families have counted on for generations.
Have always had an interest in healthcare and medicine. I've always loved the idea of teaching and problem solving and making connections. So one day my mother suggested medical social work. I didn't know much about it. I ended up applying to graduate school. I got in, and throughout most of my professional career, I've always worked in pediatric healthcare.
I realized that I wanted to help people. That was always something that was interesting to me, and friends would come to me and ask me questions, or I would have a suggestion for somebody and it turned out to be helpful. And I always loved healthcare, so being in medical social work was a draw for me. But you know, there's so many things that come up when we're able to get to. Sometimes we can't get to what we thought we would because there's crises that come through the day. Mm-hmm. So, you know, taking care of new families who come in with a new diagnosis of cancer or a potential diagnosis of cancer, taking care of children who may have come through the emergency room, who are sick or injured, providing support from the start, letting families know that from day one, as soon as you land here at Children's Hospital, there's somebody here supporting you and helping you, and you'll have a consistent presence throughout your care. So we're just ready to jump in, and sometimes you're ready to go to a meeting, you're like, sorry, I gotta go, I just got a page, and we have to go take care of a family in crisis.
I would just say, you know, our primary role here is to be the psychosocial team member, the primary psychosocial clinician. So really anticipating the needs of the whole family and just being ready to pivot at a moment's notice and to juggle multiple referrals, multiple requests for assistance. So really just going in with the idea that you're going to meet patients and families where they are and have to turn on a dime to pivot to address whatever priority issue comes in. Well, I think the biggest challenge are the restrictions regarding visitors. You know, a child needs their caregivers, their moms, their dads, their brothers and sisters to get through the cancer journey. You know, cancer is a family experience. And so when the family presence is affected in any way or limited in any way, that support system is not as robust as it could or should be.
I wholeheartedly agree. Yeah, most definitely. It's been such a challenge to have to cut away that piece that is so integral to a family and a patient's health and healing and support. That has been such a huge hardship for families, and frankly for us too, to feel like we have to be the sorry, you can't bring them in, and sorry. We can't do that. It has just been very heartbreaking. It's been really, really hard.
Yeah, I mean, I think that the whole, idea of all this virtual meeting, the technology that we've been able to put into place, programs like the Cancer Support Community, with the newly forming kid and teen and parent groups, we try to provide those psychosocial support programs here at the hospital, but sometimes this is the very last place a family wants to return to again for a support group or for an educational class or even to meet with the team. So I think in a lot of ways, the accessibility of some of our psychosocial programming and those of our community partners like Cancer Support Community has been an absolute boon. And I think from here on out, we're going to really harness and maximize that technology.
I have families who can't and would never have come to an in-person meeting because of childcare, because of transportation. Gas money is a huge thing. It's been great to know that there's so many offerings and that every day you start seeing and hearing more and more that's offered. And I think it's a really big benefit to our families and our patients. But so many people have been able to get through such a crisis or multiple crises. We have some families who've gone through COVID 2-3 times, or family members, or the loss of family members, and being able to navigate that amidst an illness, a chronic illness. So I think that's one of the biggest things that I certainly have been in all of that. I think for myself too, looking at like, whoa, because we have been here the whole time at the hospital. There were a few times when we had to take some days, here and there to be able to create, physical distancing, but we've been here the whole time. We're a service that is a face-to-face, service with our patients and families. We can't really do that remotely the whole time.
We've learned to really stop and listen and to realize that we're all in this together, but everyone's experience is a little bit unique, and we have to take the time to understand where people are coming from and what their particular beliefs or convictions are, and try to maybe up our game at listening and understanding where those differences are, because at the end of the day, we're all humans, we're all in this together, and we all have a lot of different strengths and abilities that we can share with one another to get through it. So it's been a great learning experience all the way around.
CSCLA and Providence St. John's Health Center have a long-standing and valued collaboration. CSCLA partners with St. John's to deliver support groups and healthy lifestyle classes on-site at the hospital and now online. The Providence St. John's social work team provides the quality and compassionate support that patients and families dealing with cancer expect during some of the most difficult times of their lives. Joseph Greenberg is the lead oncology social worker at the outpatient department at St. John's Cancer Institute. Joseph has worked in the field of medical social work since 2013. Caroline Seraphin is a licensed clinical social worker at Providence St. John's Health Center, where she began her career as a clinical social work intern in 2017. Both are passionate about working with oncology patients and consider it an honor to be part of each patient's journey. It is my pleasure to present the Spirit of Community Award to Joseph and Caroline at Providence St. John's Health Center. Congratulations.
I learned from early on in my life that being able to help people in need was just really rewarding. And so in going through my life and different life experiences, this path of being a social worker, specifically in oncology, is just wonderful because it is such a need, a requirement for psychosocial support for people going through cancer, and to just be able to reach out and make such a difference in people's lives when they're going through major obstacles and challenges.
So at a young age, I was really interested in psychology, in criminal justice type work. And once I did a little work in those fields, I got some more experience and had a mentor who was an LCSW. And she really opened my eyes up to social work and a lot of work you could do in the field and just amongst a variety of different populations.
Usually, I think a typical day involves being called in the moment by any one of the multiple medical specialty teams that we support to meet with a patient that they're working with. So it's kind of, we're on call throughout the day, and then we'll also have set appointments and times where we're then speaking with patients on a more of an organized kind of a schedule.
Right. Yeah, and we really work as a close team here at Providence St. John's Health Center. We have myself, Joseph, our psycho-oncologist, Dr. Gara Nathan, and then our nurse practitioner for the Cancer Support Services team, Anna Rocha. So we all talk and communicate frequently about patients, and so that's really special and unique.
But then on the patient level, it really, because there was so much isolation in the pandemic, it led to a lot more isolation in the patients, a lot more patients coming with just, worsened, more complicated mental health because they're cut off from their support systems and coming into the hospital with that.
I think even though it was hard to adjust to a lot of our support programs going virtually, it was also a silver lining because many of our patients are undergoing pretty intense oncology treatments, and a lot of them have told us that it's made it easier to access different supports that maybe they were not able to access prior to the pandemic.
Yeah, I think that I think it's motivated people to reach out and utilize the technology that we're talking about more than they would have before, because of the isolation that people we're encouraging them, but they're recognizing that they need to reach out more. They need to join groups. It's all about human connection.
Absolutely. Yeah, I think everyone's really looking for more connection. Even patients that have a lot of family and friends in the area, they can't connect with them or see them in person. So I feel that we've definitely had a higher demand of patients that are actually reaching out for the support and accessing these groups, even if they haven't in the past. Our patients are so resilient. They're going through so much as it is, and then this on top of it, it's just been an ongoing crisis, and really patients are still able to find ways to enjoy life, even if that's just a small FaceTime with a grandchild or taking a short walk outside where they don't have to interact with many people. And
I think that the pandemic has forced people to reevaluate what's important, to really see things in a different perspective, and hopefully shown them what their values are so that they can focus on those values, the connection to family, the connection to friends, the connection to community.
I'm Larissa Montalvo, and I'm the program manager at CSCLA. A part of my role is to oversee the many classes and weekly workshops that we provide. Doctors, nurses, psychologists, nutritionists, and complementary practitioners donate their time to provide the best educational information for our patients and families. Which brings me to our next honoree. CSCLA has partnered for many years with Robbie Gluckson and her team at UCLA Health. Robbie is Director of Marketing, Community Outreach and Development, Ambulatory Care at UCLA Health, and she leads a stellar group who are integral to providing education here at CSCLA. Claudia Dunn Martinez, Gabby Rodriguez, Nikki Bonner, Jack Folkert, and Robbie all work so hard and cover an incredible amount of territory in Los Angeles and beyond, connecting experts at UCLA with those who need them most. We are so grateful for their partnership. It is my pleasure to present the UCLA Health Ambulatory Care Community Outreach Team with this Spirit of Community Award. Congratulations.
At the UCLA Health Johnson Comprehensive Cancer Center, our doctors, researchers, and specialists are here for you. Our discoveries, developed for patients here and around the world. Our treatments, rigorously tested. Our journey, a collaboration, because we are part of this community.
Our days are unpredictable. Our core focus is making sure that the incredible breakthroughs across in many, many different health disciplines related to cancer, that gets into the hands of everyone, of patients at large, the community at large, in a way that is understandable. But every single day, our job is to connect those providers, medical providers, to community organizations. And your organization is beloved, and you always have sort of the best in class of information, and you touch upon very hard subjects.
But we work with a lot of different groups in the community, and I think that part of what we do, part of what I like to do, is I like to have my ear to the ground. I like to hear what kinds of needs patients have for education, what people's concerns are, so that we can connect those dots, as Robbie said. We can connect people to the information that they need, and that's a big part of what we do.
So I want to talk a little bit about downtown and oncology, because it's very different than our other cancer centers.
The diversity in downtown is sort of the melting pot of what Los Angeles is. And so while all of the areas do have that kind of a focus, downtown has a significant Korean community, for example, and I have a Korean speaking doctor down there who's very willing and able to do have conversations with the community. One of the things that, and I appreciate this, Julia, that we were able to do a couple of talks, Spanish language talks through you, and that was incredibly helpful.
Communication became very important, and we had Zoom at UCLA Health before the pandemic. We all pivoted, and we did it quickly, and we did it with inspiration and with education and with science. So we ourselves were, getting vaccinated, making decisions, reading about the science, and then we had to turn around within a few weeks and start going out en masse to do vaccine education. I'll turn to some of my folks also maybe to talk about that. Nick, what do you think in terms of COVID, greatest challenges?
Well, I think in the beginning, so much of what we do is we exchange information so much when we're face to face, and I'm sure that we all feel this. There's things you pick up when you meet people face to face that you don't necessarily get over Zoom, and I think that was a bit of a challenge in the beginning. Having said that, we got through a lot of that, and I think what we all learned was that maintaining those relationships, no matter how we do it, whether it's through Zoom or in person, that's the most important thing.
If I would say one community that really benefited because of a lot of challenges is the senior community, who didn't know really how to use Zoom or whatever, and we looked to our partners with the senior resource centers, the senior living communities and whatnot, and we worked with them to get some of this information out, whether it was on COVID or cancer or anything really, but a lot of them just with some who are scared and who are isolated in some of those assisted living facilities. I mean, I think those kinds of things were things that we didn't really face before so much. I mean, a fear, and I felt like that was such an eye-opener.
It's very, very important that every person have a primary care doctor. And the message that I bring on behalf of UCLA Health is there is nothing more important than your health. Because if you don't take care of yourself, you can't take care of people you love. And it's our moment, all of us collectively in healthcare. We have a very powerful campaign called Better Together. We want everyone to focus on preventive health. And of course, what happened with COVID is people had such a fear that they would get COVID if they went to their primary care doctor, and especially cancer patients who put off screenings, and cancer survivors who screening is such an important part of the cancer journey once you finish treatment. So the watershed moment is, and the lesson is, please have a primary care doctor and get the screenings, especially because you can prevent so many cancers.
congratulations to all the hospital networks and partners. Well deserved and well earned. So, good health to you all. And once again, congratulations.
At Cancer Support Community Los Angeles, we are dedicated to reducing barriers and increasing access for all individuals and families impacted by cancer. Free services, free parking, and services for the long term too, for as long as they are needed. I hope you have enjoyed this look into the worlds of these caring professionals and into the Cancer Support Community Los Angeles. Isn't it good to know that these amazing supportive care teams that our hospitals honored today are available if we or our loved ones ever receive a diagnosis of cancer? Thank you again for your contributions, and thank you to our sponsors for making this event possible. Have a great day.